Question 1. A nurse is preparing to administer medications through a nasogastric tube. Which actions should the nurse take? Select all that apply. A. Crush all medications into a fine powder and mix with water. B. Verify tube placement before administration. C. Aspirate gastric contents and check pH. D. Flush the tube with 15 to 30 milliliters of water before and after each medication. E. Administer medications one at a time. F. Mix all medications together and administer as a single bolus. Answer. Verify tube placement before administration, aspirate gastric contents and check pH. Flush the tube with 15 to 30 milliliters of water before and after each medication. Administer medications one at a time. This question tests knowledge of safe medication administration via nasogastric (NG) tube, a crucial nursing skill. Before administering anything, it is vital to verify tube placement by aspirating gastric contents and checking the pH to confirm it is in the stomach, preventing medication from entering the lungs. Each medication should be administered separately, with the tube flushed before and after each to prevent clogging and ensure the full dose is delivered, never mixing all medications together or crushing extended-release tablets. For example, if a client needs 2 medications, the nurse would give the first, flush, then give the second, and flush again. Always remember that patient safety is paramount, and proper NG tube medication technique prevents serious complications. Question 2. The nurse is assessing a client admitted with fluid volume overload. Which findings would the nurse anticipate? Select all that apply. A. Decreased blood pressure. B. Distended neck veins. C. Dry mucous membranes. D. Bounding peripheral pulses. E. Crackles in the lungs. F. Weight loss. Answer. Distended neck veins, bounding peripheral pulses, crackles in the lungs. This question addresses the assessment of fluid volume overload, a condition where the body retains too much fluid. The key is to recognize signs of increased intravascular and interstitial fluid. Distended neck veins, jugular venous distension, bounding peripheral pulses, and crackles in the lungs, indicating pulmonary edema, are classic signs of fluid excess. Conversely, decreased blood pressure, dry mucous membranes, and weight loss are typically associated with fluid volume deficit. For instance, hearing crackles in the bases of the lungs alerts the nurse to excess fluid accumulating in the alveoli. Remember that the body's fluid balance significantly impacts cardiovascular and respiratory function. Question 3. A client with a new prescription for warfarin is receiving discharge teaching. Which instructions are essential for the nurse to provide? Select all that apply. A. Take aspirin for any minor aches or pains. B. Report any signs of bleeding, such as unusual bruising or bloody stools. C. Maintain a consistent intake of vitamin K-rich foods. D. Avoid contact sports and activities that may cause injury. E. Get regular blood tests, PT/INR, as ordered by the provider. F. Increase fluid intake to prevent constipation. Answer. Report any signs of bleeding, such as unusual bruising or bloody stools. Maintain a consistent intake of vitamin K-rich foods. Avoid contact sports and activities that may cause injury. Get regular blood tests, PT/INR, as ordered by the provider. This question focuses on critical patient education for warfarin, an anticoagulant that prevents blood clots. The most important instructions revolve around monitoring for bleeding, understanding dietary interactions, preventing injury, and adhering to monitoring schedules. Patients must report any signs of bleeding immediately, maintain a consistent intake of vitamin K, which can affect warfarin's effectiveness, avoid activities that could cause injury due to increased bleeding risk, and undergo regular PT/INR tests to ensure the medication is within a therapeutic range. Taking aspirin, an additional antiplatelet, can significantly increase bleeding risk and should be avoided without specific provider instruction, and increasing fluids is generally good but not specific to warfarin. For example, teaching a client to use an electric razor instead of a blade reduces the risk of nicks and bleeding. Remember, safety and consistent monitoring are key with anticoagulants. Question 4. The nurse is caring for a client with AC, difficile infection. Which interventions are appropriate for the nurse to implement? Select all that apply. A. Place the client in a private room. B. Use alcohol-based hand sanitizer before and after client care. C. Wear gloves for all client contact. D. Wear a gown when entering the client's room. E. Disinfect surfaces with a bleach-based solution. F. Encourage family members to wear masks. Answer. Place the client in a private room, wear gloves for all client contact, wear a gown when entering the client's room, disinfect surfaces with a bleach-based solution. This question addresses infection control for Clostridioides difficile, C. difficile, a highly contagious bacterium causing severe diarrhea. Proper infection control measures are essential to prevent its spread, primarily through contact transmission. Placing the client in a private room, wearing gloves and gowns for all contact, and using bleach-based disinfectants, as alcohol-based sanitizers are ineffective against C. difficile spores, are crucial components of contact precautions. Masks are not typically required for C. difficile unless other airborne precautions are also in place, and alcohol hand rub is not sufficient. For example, before exiting the room, the nurse would remove the gown and gloves, discard them, and then perform hand hygiene with soap and water, not just sanitizer. Understanding proper isolation techniques is vital for patient and staff safety. Question 5. The nurse is providing discharge instructions to a client with heart failure. Which statements by the client indicate a need for further teaching? Select all that apply. A. I will weigh myself daily and report a gain of 3 pounds in one day. B. I should call my doctor if my ankles start to swell. C. I can eat as much canned soup as I want since it's easy to prepare. D. I should limit my fluid intake to 2 liters per day. E. I will take my diuretic medication every other day. F. I will decrease my exercise if I feel tired. Answer. I can eat as much canned soup as I want since it's easy to prepare. I will take my diuretic medication every other day. I will decrease my exercise if I feel tired. This question assesses understanding of self-management for heart failure, a condition requiring careful monitoring and adherence to lifestyle modifications. The client's statements about eating unlimited canned soup, taking diuretics every other day, and decreasing exercise if tired indicate a need for further teaching. Canned soup is often high in sodium, which exacerbates fluid retention. Diuretics should be taken as prescribed, usually daily, to manage fluid balance, and while rest is important, sudden decreases in prescribed exercise might indicate worsening symptoms that need assessment, not just self-limitation. Conversely, daily weight monitoring for a 2 to 3 pounds gain, reporting ankle swelling, and fluid restriction are all appropriate self-care measures. For example, if a client starts retaining fluid, the daily weight check would be the first indicator, prompting a call to the provider. Empowering clients with accurate knowledge helps prevent exacerbations and hospital readmissions. Question 6. A nurse is caring for a client with acute kidney injury. Which laboratory findings would the nurse expect? Select all that apply. A. Decreased blood urea nitrogen, BUN. B. Elevated serum creatinine. C. Hyperkalemia. D. Hypophosphatemia. E. Metabolic acidosis. F. Hypocalcemia. Answer: elevated serum creatinine, hyperkalemia, metabolic acidosis, hypocalcemia. This question tests the understanding of common laboratory abnormalities seen in acute kidney injury, AKI, where the kidneys suddenly lose their ability to remove waste products. In AKI, the kidneys cannot effectively excrete waste or regulate electrolytes and acid-base balance. Therefore, the nurse would expect to see elevated serum creatinine and blood urea nitrogen, BUN, hyperkalemia, high potassium, metabolic acidosis, due to inability to excrete acid E, and hypocalcemia, low calcium, because of impaired vitamin D activation and phosphate retention. Hypophosphatemia and decreased BUN are typically not seen in AKI. For example, a client's potassium level soaring to 6.0 milliequivalent/L would be a critical finding indicating impaired renal function. Recognizing these lab values helps guide nursing interventions and medical management for AKI. Question 7. The nurse is preparing to insert a peripheral intravenous 4 catheter. Which actions demonstrate appropriate technique? Select all that apply. A. Select a vein distal to a previous venipuncture site. B. Apply a tourniquet 4 to 6 inches above the chosen insertion site. C. Cleanse the insertion site with an antiseptic solution using a back and forth scrubbing motion for 30 seconds. D. Insert the catheter with the bevel up at a 10 to 30 degree angle. E. Flush the newly inserted catheter with normal saline. F. Apply pressure above the insertion site after removing the stylet. Answer: apply a tourniquet 4 to 6 inches above the chosen insertion site. Cleanse the insertion site with an antiseptic solution using a back and forth scrubbing motion for 30 seconds. Insert the catheter with the bevel up at a 10 to 30 degree angle. Flush the newly inserted catheter with normal saline. This question focuses on the correct procedure for inserting a peripheral 4 catheter, a fundamental nursing skill. Proper technique is crucial to prevent complications and ensure successful venous access. Applying a tourniquet 4 to 6 inches above the site, cleansing the skin thoroughly with an antiseptic, e.g., chlorhexidine, using a back and forth scrub for 30 seconds, inserting the catheter bevel up at a shallow angle, and flushing the catheter to confirm patency are all correct steps. Selecting a vein distal to a previous site is generally preferred to preserve more proximal sites, and pressure should be applied above the insertion site with the stylet still partially in or below the site after removal to prevent blood spillage, not above after removing the stylet entirely. For example, after inserting the catheter and seeing a blood return, the nurse would advance the catheter, remove the stylet, engage the safety mechanism, and then flush. Mastering these steps ensures patient comfort and safety during IV therapy. Question 8. The nurse is caring for a client receiving total parenteral nutrition, TPN. Which nursing interventions are appropriate for this client? Select all that apply. A. Change the TPN tubing every 72 hours. B. Monitor blood glucose levels frequently. C. Administer TPN through a peripheral 4 site. D. Weigh the client daily. E. Administer insulin as prescribed for hyperglycemia. F. Monitor for signs of infection at the central line site. Answer: monitor blood glucose levels frequently, weigh the client daily, Administer insulin as prescribed for hyperglycemia. Monitor for signs of infection at the central line site. This question covers essential nursing care for clients receiving total parenteral nutrition, TPN, a highly concentrated intravenous solution for nutritional support. TPN is hypertonic and must be administered through a central venous access device, not a peripheral because it can cause phlebitis. Due to its high dextrose content, frequent blood glucose monitoring is crucial to manage potential hyperglycemia, and insulin may be administered to control it. Daily weights are vital to assess fluid balance and nutritional status, and rigorous monitoring for infection at the central line site is paramount given the high risk. TPN tubing should be changed every 24 hours with each new bag of TPN, not every 72 hours. For example, if a client's blood glucose rises above the target range, the nurse would administer prescribed sliding-scale insulin to prevent complications. Strict adherence to protocols for TPN administration and monitoring minimizes serious complications. Question 9. A client diagnosed with hyperthyroidism is admitted to the hospital. Which assessment findings would the nurse anticipate? Select all that apply. A. Weight gain. B. Bradycardia. C. Heat intolerance. D. Exophthalmos. E. Diarrhea. F. Lethargy. Answer: heat intolerance, exophthalmos, diarrhea. This question tests the understanding of the clinical manifestations of hyperthyroidism, a condition characterized by excessive production of thyroid hormones. These hormones increase the body's metabolic rate. Anticipated findings include heat intolerance, exophthalmos, bulging eyes, and diarrhea due to increased GI motility. Conversely, weight gain, bradycardia, slow heart rate, and lethargy are typical signs of hypothyroidism. For example, a client complaining of always feeling hot, even in a cool room, is exhibiting a classic symptom of hyperthyroidism. Recognizing these distinct signs helps differentiate thyroid disorders and guide appropriate care. Question 10. The nurse is caring for a client who is NPO and complaining of thirst. Which comfort measures are appropriate for this client? Select all that apply. A. Offer sips of water. B. Provide frequent oral hygiene. C. Apply lip balm. D. Offer hard candy or gum. E. Moisten lips with a wet cloth. F. Provide ice chips. Answer: provide frequent oral hygiene, apply lip balm, moisten lips with a wet cloth. This question addresses appropriate comfort measures for a client who is NPO, nil per os, or nothing by mouth, a common situation in healthcare. When a client is NPO, nothing, including sips of water, ice chips, hard candy, or gum, should be given by mouth, as these would break the NPO status. Appropriate comfort measures focus on alleviating dry mouth and discomfort without intake. Frequent oral hygiene, e.g., brushing teeth, rinsing with mouthwash without swallowing, applying lip balm to prevent chapping, and moistening the lips with a wet cloth or sponge are safe and effective ways to provide relief. For example, a nurse can use a toothette to gently clean the client's mouth and then apply petroleum jelly to their lips. Remembering that NPO means absolutely nothing by mouth ensures patient safety for impending procedures or conditions. Question 11. A client is receiving intravenous potassium chloride. Which nursing actions are essential during the infusion? Select all that apply. A. Administer the infusion as a rapid 4 bolus. B. Monitor the client's cardiac rhythm continuously. C. Assess the 4 insertion site frequently for phlebitis or infiltration. D. Dilute the potassium chloride in a large volume of 4 fluid. E. Ensure the infusion rate does not exceed 10 milliequivalent/hour. F. Administer undiluted potassium chloride via 4 push. Answer. Monitor the client's cardiac rhythm continuously, assess the 4 insertion site frequently for phlebitis or infiltration, dilute the potassium chloride in a large volume of 4 fluid, ensure the infusion rate does not exceed 10 milliequivalent/hour. This question focuses on the safe administration of intravenous potassium chloride, a high-alert medication due to its potential for serious adverse effects. Potassium must never be administered as a rapid 4 bolus or undiluted via 4 push, as this can cause fatal cardiac arrhythmias. It must always be diluted in a large volume of 4 fluid and infused slowly, typically not exceeding 10 milliequivalent/hour in peripheral lines or 20 milliequivalent/hour in central lines, with continuous cardiac monitoring. Continuous cardiac monitoring is essential because both hypokalemia and hyperkalemia can lead to life-threatening arrhythmias, and frequent assessment of the foresight is crucial as potassium is a vesicant and can cause significant irritation if it infiltrates. For instance, if the client's heart rhythm suddenly changes during the infusion, the nurse must immediately stop the infusion and notify the provider. Always remember that potassium, should never be pushed. Question 12. The nurse is teaching a client about colostomy care. Which statements indicate effective teaching? Select all that apply. A. I should empty my pouch when it is about 1/3 to 1/2 full. B. I can place an aspirin in my pouch to help with odor control. C. I should irrigate my colostomy daily to regulate bowel movements. D. I will change my pouch system every day. E. I should clean the skin around the stoma with mild soap and water. F. I will watch for any changes in the color or size of my stoma. Answer. I should empty my pouch when it is about 1/3 to 1/2 full. I should clean the skin around the stoma with mild soap and water. I will watch for any changes in the color or size of my stoma. This question assesses proper colostomy care, a critical aspect of self-management for clients with a colostomy. Clients should empty their pouch when it is 1/3 to 1/2 full to prevent leakage and skin irritation, clean the peristomal skin with mild soap and water to maintain skin integrity, and monitor the stoma for changes in color, should be pink/red and moist, or size, which could indicate complications. Irrigating a colostomy is not always indicated for all clients and requires specific instruction, and changing the entire pouch system daily is usually unnecessary and costly. Typically, it's changed every 3 to 7 days. Placing aspirin in the pouch is not an approved method for odor control. For example, if a client notices their stoma turning dusky or purple, they should immediately report it to the provider. Empowering clients with accurate colostomy care knowledge helps prevent complications and promotes independence. Question 13. A nurse is preparing to delegate tasks to an unlicensed assistive personnel, UAP. Which tasks are appropriate for the nurse to delegate? Select all that apply. A. Administering oral medications to a stable client. B. Performing an initial assessment on a newly admitted client. C. Assisting a client with ambulation. D. Obtaining vital signs for a client with stable hypertension. E. Providing post-mortem care. F. Teaching a client about discharge medications. Answer. Assisting a client with ambulation, obtaining vital signs for a client with stable hypertension, providing post-mortem care. This question tests the nurse's understanding of delegation principles, specifically which tasks can be safely delegated to an unlicensed assistive personnel, UAP. UAPs can perform tasks that are within their scope of practice, generally involving stable clients and routine care, but cannot perform assessment, teaching, or medication administration. Assisting with ambulation, obtaining vital signs for a stable client, and providing post-mortem care are appropriate tasks for a UAP. Administering medications, performing initial assessments, and providing discharge teaching require the clinical judgment and specialized knowledge of a licensed nurse. For instance, the nurse can tell the UAP, "Please help Mr. Smith walk to the bathroom and then take his blood pressure." Proper delegation frees the nurse to focus on more complex care needs while ensuring all client needs are met efficiently. Question 14. A client is experiencing a severe allergic reaction, anaphylaxis. Which nursing actions are priority? Select all that apply. A. Administer diphenhydramine intramuscularly. B. Elevate the client's legs if blood pressure is low. C. Administer epinephrine intramuscularly. D. Maintain a patent airway. E. Administer 4 fluids rapidly. F. Initiate continuous cardiac monitoring. Answer. Elevate the client's legs if blood pressure is low. Administer epinephrine intramuscularly, maintain a patent airway, administer 4 fluids rapidly, initiate continuous cardiac monitoring. This question tests the nurse's ability to prioritize interventions for a client experiencing anaphylaxis, a life-threatening allergic reaction. The immediate priorities are to maintain a patent airway, administer epinephrine, the first-line treatment, intramuscularly, rapidly infuse 4 fluids to combat hypotension, initiate continuous cardiac monitoring, and elevate the client's legs if hypotensive to improve cerebral perfusion. While diphenhydramine is often given, epinephrine and airway management are the immediate life-saving interventions. For example, after calling for help, the nurse would immediately inject epinephrine into the client's thigh and prepare for intubation if airway compromise worsens. Recognizing the signs of anaphylaxis and acting swiftly is crucial to save a client's life. Question 15. The nurse is caring for a client with a new cast on the right arm. Which findings would require immediate notification of the healthcare provider? Select all that apply. A. Swelling distal to the cast. B. Capillary refill of 2 seconds in the fingers. C. Inability to move the fingers on the right hand. D. Complaints of numbness and tingling in the right hand. E. Warmth to the touch of the right fingers. F. Pain unrelieved by analgesics. Answer. Swelling distal to the cast, inability to move the fingers on the right hand, complaints of numbness and tingling in the right hand, pain unrelieved by analgesics. This question assesses the nurse's ability to recognize signs of potential complications, specifically compartment syndrome, in a client with a new cast. The 5 Ps, pain, pallor, pulselessness, paresthesia, paralysis, are critical assessment findings that indicate neurovascular compromise. Swelling distal to the cast, inability to move the fingers, paralysis, numbness and tingling, paresthesia, and pain unrelieved by analgesics are all emergent signs requiring immediate notification of the healthcare provider. Capillary refill of 2 seconds and warmth are normal findings. For instance, if a client reports excruciating pain in the casted limb that doesn't improve with medication and describes their fingers as pins and needles, this warrants urgent action. Early detection and intervention for compartment syndrome are vital to prevent permanent tissue damage. Question 16. A client is scheduled for a barium swallow. Which pre-procedure instructions should the nurse provide? Select all that apply. A. You will need to be NPO for 8 hours before the test. B. Expect to have white stools for 24 to 72 hours after the procedure. C. Drink plenty of fluids after the test to help eliminate the barium. D. You will receive an 4-contrast dye during the procedure. E. You will need to lie still on an X-ray table during the procedure. F. You should take your routine morning medications as usual. Answer. You will need to be NPO for 8 hours before the test. Expect to have white stools for 24 to 72 hours after the procedure. Drink plenty of fluids after the test to help eliminate the barium. You will need to lie still on an X-ray table during the procedure. This question evaluates the nurse's knowledge of pre- and post-procedure care for a barium swallow, a diagnostic test for the upper gastrointestinal tract. Clients must be NPO for 8 hours prior to the test to ensure accurate imaging and prevent aspiration. After the procedure, they should expect white stools due to the barium and must increase fluid intake to help eliminate the barium and prevent constipation. Clients also need to lie still during the X-ray imaging. An 4-contrast dye is not typically used for a barium swallow, and routine medications might need to be held, especially if they affect GI motility. For example, if the client arrives having had breakfast, the procedure would need to be rescheduled. Clear instructions help ensure test accuracy and prevent complications. Question 17. The nurse is assessing a client for manifestations of hypoglycemia. Which findings should the nurse expect? Select all that apply. A. Hot, dry skin. B. Fruity breath odor. C. Shakiness and tremors. D. Polyuria. E. Sweating. F. Irritability. Answer. Shakiness and tremors, sweating, irritability. This question assesses the nurse's ability to recognize the signs and symptoms of hypoglycemia, a condition of low blood sugar. Hypoglycemia often manifests with adrenergic symptoms as the body attempts to raise blood glucose. These include shakiness, tremors, sweating, and irritability, as well as hunger, palpitations, and pallor. Hot, dry skin, fruity breath odor, and polyuria are classic signs of hyperglycemia. For instance, if a client with diabetes suddenly becomes confused and diaphoretic, the nurse should immediately suspect hypoglycemia and check their blood sugar. Prompt recognition and treatment of hypoglycemia are vital to prevent severe neurological complications. Question 18. A client is receiving a continuous enteral feeding via a gastrostomy tube. Which interventions are appropriate for the nurse to implement? Select all that apply. A. Position the client supine during the feeding. B. Check gastric residual volume every 4 to 6 hours. C. Flush the tube with water every 4 hours. D. Elevate the head of the bed to at least 30 to 45 degrees. E. Administer medications through the feeding tube with the feeding running. F. Change the feeding bag and tubing every 24 hours. Answer. Check gastric residual volume every 4 to 6 hours, flush the tube with water every 4 hours, elevate the head of the bed to at least 30 to 45 degrees, change the feeding bag and tubing every 24 hours. This question addresses the safe administration and management of continuous enteral feedings through a gastrostomy tube. To prevent aspiration, the head of the bed must be elevated to at least 30 to 45 degrees during the feeding and for 1 hour afterward. Gastric residual volume should be checked every 4 to 6 hours to assess for feeding intolerance. The tube should be flushed with water every 4 hours to maintain patency, and feeding bags and tubing must be changed every 24 hours to prevent bacterial growth. Administering medications while the feeding is running can interfere with absorption. The feeding should be paused, the tube flushed, medication given, and then flushed again before restarting the feeding. For example, if the nurse checks residual volume and finds it significantly higher than the previous check, they would hold the feeding and notify the provider. Strict adherence to these protocols ensures client safety and optimal nutrition. Question 19. The nurse is educating a client diagnosed with iron deficiency anemia about dietary modifications. Which foods should the nurse recommend? Select all that apply. A. Spinach. B. Milk. C. Red meat. D. Eggs. E. Oranges. F. Whole grain bread. Answer: spinach, red meat, eggs, oranges, whole grain bread. This question focuses on dietary management for iron deficiency anemia, a condition where the body lacks sufficient iron to produce hemoglobin. To increase iron intake, the nurse should recommend foods rich in iron, such as spinach, non-heme iron, red meat, heme iron, eggs, and whole grain bread. Additionally, foods high in vitamin C, like oranges, help improve the absorption of non-heme iron. Milk, while nutritious, is not a good source of iron and can even inhibit iron absorption if consumed with iron-rich foods. For instance, teaching a client to pair an iron-fortified cereal with orange juice for breakfast can maximize iron absorption. Emphasizing a balanced diet with iron-rich and vitamin C-containing foods is key to managing anemia. Question 20. The nurse is assessing a client who is receiving a blood transfusion. Which findings indicate a potential hemolytic transfusion reaction? Select all that apply. A. Flank pain. B. Urticaria. C. Hypotension. D. Fever and chills. E. Bradycardia. F. Pink-tinged urine. Answer: flank pain, hypotension, fever and chills, pink-tinged urine. This question tests the nurse's ability to recognize signs of a hemolytic transfusion reaction, a serious and potentially life-threatening complication where the recipient's antibodies attack the donor's red blood cells. Classic signs include flank pain, hypotension, fever, chills, and pink-tinged or red urine, hemoglobinuria, due to the breakdown of red blood cells. Urticaria, hives, is more characteristic of an allergic reaction, not typically a hemolytic one, and bradycardia is not a common sign. Tachycardia is more likely due to hypovolemia. For example, if a client receiving blood suddenly reports severe back pain and becomes hypotensive, the nurse must immediately stop the transfusion. Prompt identification and intervention are critical to mitigate the severity of a hemolytic reaction. Question 21. A nurse is providing care for a client with an indwelling urinary catheter. Which interventions help prevent a catheter-associated urinary tract infection, CAUTI? Select all that apply. A. Perform perineal care with soap and water daily. B. Ensure the drainage bag is kept below the level of the bladder. C. Empty the drainage bag when it is completely full. D. Secure the catheter to the client's thigh. E. Irrigate the catheter routinely with sterile saline. F. Use a septic technique during catheter insertion. Answer: perform perineal care with soap and water daily, ensure the drainage bag is kept below the level of the bladder, secure the catheter to the client's thigh, use a septic technique during catheter insertion. This question addresses essential nursing interventions to prevent catheter-associated urinary tract infections, CAUTIs, a common healthcare-associated infection. Preventing CAUTIs involves meticulous hygiene, proper catheter management, and a septic technique during insertion. Key interventions include performing daily perineal care, keeping the drainage bag below the bladder to prevent reflux, securing the catheter to prevent urethral trauma and movement, and using strict aseptic technique during insertion. Emptying the drainage bag when it is only 1/2 to 2/3 full prevents excessive pooling and backflow, and routine catheter irrigation is not recommended as it can introduce bacteria. For example, ensuring the drainage tubing has no kinks and the bag remains below the bed level prevents urine from sitting in the tubing. Consistent adherence to these practices significantly reduces the risk of infection. Question 22. The nurse is preparing to administer a medication that requires an apical pulse assessment. Which conditions would necessitate an apical pulse assessment for 60 seconds? Select all that apply. A. The client is receiving digoxin. B. The client has an irregular heart rhythm. C. The client is elderly. D. The client is an infant. E. The client is experiencing anxiety. E. The client is receiving a beta blocker. Answer. The client is receiving digoxin. The client has an irregular heart rhythm. The client is an infant. The client is receiving a beta blocker. This question focuses on identifying situations requiring a full 60-second apical pulse assessment, a more accurate measurement than radial pulse in specific contexts. An apical pulse should be assessed for a full minute when administering medications that affect heart rate and rhythm, e.g., digoxin, beta blockers, if the client has an irregular heart rhythm, or if the client is an infant or young child, as their heart rates are faster and often more irregular. While elderly clients may have some cardiac changes, it does not automatically necessitate a 60-second apical pulse unless other conditions are met, and anxiety alone is not a direct indication. For example, before giving digoxin, the nurse must listen for a full minute at the apex to ensure the heart rate is above 60 beats per minute. This careful assessment ensures medication safety and accurate baseline data. Question 23. A client with a head injury develops increased intracranial pressure, ICP. Which findings would the nurse expect? Select all that apply. A. Bradycardia. B. Meiosis, pupillary constriction. C. Hypotension. D. Decerebrate posturing. E. Bradypnea. E. Widening pulse pressure. Answer. Bradycardia, decerebrate posturing, bradypnea, widening pulse pressure. This question tests the nurse's understanding of the signs of increased intracranial pressure, ICP, a critical neurological emergency. Increased ICP is characterized by Cushing's triad, bradycardia, slow heart rate, bradypnea, slow respiratory rate, and widening pulse pressure, increasing difference between systolic and diastolic blood pressure. Other signs include changes in level of consciousness, pupil changes, though often dilated and fixed, not constricted E, and abnormal posturing like decerebrate, extension of all extremities. Hypotension is not typical. Hypertension is expected as the body tries to perfuse the brain. For instance, if a client with a head injury suddenly develops a blood pressure of 180/60 and a heart rate of 50, the nurse must recognize this as a critical sign of rising ICP. Prompt recognition and intervention are vital to prevent irreversible brain damage. Question 24. The nurse is reinforcing teaching about wound care for a client with a pressure injury. Which statements by the client indicate a good understanding? Select all that apply. A. I will change my dressing once a week. B. I should keep the wound moist, not dry. C. I will avoid lying on the affected area. D. I will eat more protein to help my wound heal. E. I will clean the wound with hydrogen peroxide. E. I will report any redness or foul odor from the wound. Answer: I should keep the wound moist, not dry. I will avoid lying on the affected area. I will eat more protein to help my wound heal. I will report any redness or foul odor from the wound. This question assesses a client's understanding of proper wound care for a pressure injury, focusing on principles that promote healing and prevent complications. Effective teaching involves emphasizing a moist wound environment, pressure relief, adequate nutrition, and recognizing signs of infection. The client should keep the wound moist, not dry, to facilitate healing, avoid lying on the affected area to prevent further breakdown, increase protein intake for tissue repair, and report any signs of infection like redness or foul odor. Changing the dressing once a week may be too infrequent depending on the wound, and hydrogen peroxide is generally not recommended for routine wound cleaning as it can damage healthy tissue. For example, if a client typically lies on their back, they should be encouraged to switch to side-lying positions every 2 hours. Adherence to these guidelines is crucial for successful wound healing and preventing complications. Question 25. A client is prescribed a liquid iron supplement. Which instructions should the nurse provide to the client? Select all that apply. A. Take the iron with milk to prevent stomach upset. B. Dilute the iron in juice or water before taking it. C. Take the iron with a straw to prevent staining your teeth. D. Expect your stools to become black and tarry. E. Take the iron with antacids if you experience heartburn. F. Report any constipation to your provider. Answer: dilute the iron in juice or water before taking it. Take the iron with a straw to prevent staining your teeth. Expect your stools to become black and tarry. Report any constipation to your provider. This question focuses on appropriate client education for liquid iron supplements, which are often prescribed for iron deficiency anemia. To minimize side effects and optimize absorption, clients should dilute the iron in juice or water and use a straw to prevent staining teeth. They should also be informed that black, tarry stools are a common and expected side effect, and any constipation should be reported as it may worsen. Taking iron with milk can inhibit absorption, and antacids can also interfere with iron absorption. Iron is best absorbed on an empty stomach or with vitamin C-rich foods. For example, if a client takes iron supplements and notices their teeth becoming discolored, the nurse would remind them to use a straw. Proper administration techniques enhance compliance and therapeutic outcomes. Question 26. The nurse is caring for a client with a history of alcohol use disorder who is experiencing acute alcohol withdrawal. Which medications would the nurse anticipate administering? Select all that apply. A. Lorazepam. B. Naltrexone. C. Thiamine. D. Folic acid. E. Disulfiram. F. Chlordiazepoxide. Answer: lorazepam, thiamine, folic acid, chlordiazepoxide. This question tests the nurse's knowledge of pharmacological interventions for acute alcohol withdrawal, a potentially life-threatening condition. Benzodiazepines, such as lorazepam and chlordiazepoxide, are the cornerstone of treatment to reduce CNS excitability and prevent seizures. Thiamine and folic acid are routinely given to clients with alcohol use disorder to prevent and treat Wernicke-Korsakoff syndrome and other nutritional deficiencies. Naltrexone and disulfiram are used for long-term alcohol abstinence, not for acute withdrawal. For example, if a client begins experiencing tremors and increased anxiety during withdrawal, the nurse would administer lorazepam as ordered to calm the nervous system. Administering these medications safely helps manage withdrawal symptoms and prevents severe complications like delirium tremens. Question 27. A nurse is preparing a sterile field for a dressing change. Which actions indicate appropriate aseptic technique? Select all that apply. A. Place the sterile drape with the shiny side down. B. Open the first flap of the sterile package towards the nurse. C. Avoid talking over the sterile field. D. Maintain a 1-inch border around the edge of the sterile field as non-sterile. E. Add sterile supplies to the field by dropping them from a height. F. Don sterile gloves before opening any sterile supplies. Answer. Avoid talking over the sterile field. Maintain a 1-inch border around the edge of the sterile field as non-sterile. This question addresses the crucial principles of maintaining a sterile field, a fundamental aspect of infection control in nursing. To ensure asepsis, nurses must avoid talking, coughing, or sneezing over the sterile field to prevent contamination from airborne droplets. Additionally, the outer 1-inch border of a sterile field is considered non-sterile, and any items placed or touched within this border compromise sterility. The first flap of a sterile package should be opened away from the nurse, not towards them, to avoid reaching over the field. Sterile supplies should be added to the field carefully, not dropped from a height. Sterile gloves are donned after the sterile field is established and opened, not before. For example, if a nurse accidentally brushes the edge of their gown against the sterile field, the field is contaminated and must be reset. Adherence to these strict rules is paramount to prevent healthcare-associated infections. Question 28. The nurse is educating a client with chronic obstructive pulmonary disease, COPD, about managing their condition. Which instructions should the nurse include? Select all that apply. A. Limit fluid intake to prevent fluid retention. B. Perform pursed lip breathing to help with shortness of breath. C. Get a flu vaccine annually. D. Avoid large meals to prevent diaphragm compression. E. Increase oxygen flow rate if you feel short of breath. F. Report any increase in sputum production or change in color. Answer. Perform pursed lip breathing to help with shortness of breath. Get a flu vaccine annually. Avoid large meals to prevent diaphragm compression. Report any increase in sputum production or change in color. This question focuses on essential self-management strategies for clients with chronic obstructive pulmonary disease, COPD, a chronic respiratory condition. Key instructions include performing pursed lip breathing to prolong exhalation and improve gas exchange, getting annual flu and pneumonia vaccines to prevent exacerbations, avoiding large meals to prevent diaphragm compression and allow for easier breathing, and reporting any changes in sputum as it may indicate an infection. Limiting fluid intake is generally discouraged for COPD clients, as adequate hydration helps thin secretions, and increasing oxygen flow without a provider's order can be dangerous for clients with chronic CO2 retention, potentially suppressing their respiratory drive. For instance, teaching a client to take slow, deep breaths, then exhale slowly through pursed lips, helps them manage dyspnea. Empowering clients with these techniques helps them maintain optimal respiratory function and quality of life. Question 29. A nurse is administering medications to a client. Which actions are essential to ensure medication safety? Select all that apply. A. Check the client's wristband against the MAR 3 times. B. Crush all tablets that are difficult for the client to swallow. C. Document medication administration immediately after giving the drug. D. Ask the client to state their name and date of birth. E. Administer a medication prepared by another nurse if it's an emergency. F. Scan the client's armband and medication barcode. Answer. Check the client's wristband against the MAR 3 times. Document medication administration immediately after giving the drug. Ask the client to state their name and date of birth. Scan the client's armband and medication barcode. This question addresses fundamental principles of medication safety, specifically emphasizing the rights of medication administration and proper identification. Essential actions include verifying the client's identity using two identifiers, e.g., name and date of birth, and comparing the wristband to the MAR, medication administration record 3 times, along with scanning barcodes, which are critical safety checks. Documentation must occur immediately after administration to ensure accuracy. Crushing tablets should only be done if the medication is not extended-release, enteric-coated, or contraindicated for crushing, and a medication prepared by another nurse should never be administered by a different nurse due to the risk of error. For example, if a client states a different name when asked to confirm, the nurse must re-verify the identity before proceeding. Adhering to these strict protocols prevents medication errors and protects client safety. Question 30. The nurse is assessing a client for dehydration. Which findings would support a diagnosis of dehydration? Select all that apply. A. Moist mucous membranes. B. Flat neck veins. C. Increased urine output. D. Poor skin turgor. E. Orthostatic hypotension. F. Tachycardia. Answer. Flat neck veins, poor skin turgor, orthostatic hypotension, tachycardia. This question evaluates the nurse's ability to identify clinical manifestations of dehydration, a state of fluid volume deficit. Dehydration causes a decrease in intravascular and interstitial fluid. Anticipated findings include flat neck veins, poor skin turgor, skin tenting, orthostatic hypotension, a drop in blood pressure with position changes, and tachycardia, increased heart rate, as the body attempts to compensate for decreased blood volume. Moist mucous membranes and increased urine output are signs of adequate hydration or fluid excess. For instance, if a client's blood pressure drops significantly when standing up, coupled with a fast heart rate, it strongly suggests dehydration. Recognizing these signs is crucial for prompt rehydration and preventing further complications. Question 31. A client is experiencing delirium. Which nursing interventions are appropriate for managing this condition? Select all that apply. A. Maintain a consistent daily routine. B. Speak in a loud voice to get the client's attention. C. Provide a well-lit, quiet environment. D. Reorient the client frequently to person, place, and time. E. Use restraints to prevent agitation and confusion. F. Encourage family members to stay with the client. Answer. Maintain a consistent daily routine, provide a well-lit, quiet environment, reorient the client frequently to person, place, and time, encourage family members to stay with the client. This question focuses on appropriate nursing interventions for clients experiencing delirium, an acute state of confusion often characterized by fluctuations in mental status. To manage delirium, nurses should establish a consistent daily routine, provide a well-lit and quiet environment to minimize sensory overload, frequently reorient the client, and encourage family presence to provide comfort and familiarity. Speaking loudly or using restraints can worsen agitation and confusion and should be avoided. For example, ensuring the client has a clock and calendar visible and gently reminding them of the date and where they are can help reduce disorientation. Creating a calm and structured environment supports cognitive function and reduces the severity of delirium. Question 32. The nurse is teaching a client about self-monitoring blood glucose, SMBG. Which instructions should the nurse include? Select all that apply. A. Always use the same finger for testing to ensure consistency. B. Wash your hands with soap and warm water before testing. C. Prick the side of your finger, not the center. D. You can share your Lancet device with family members to save money. E. Record your results in a logbook. F. Calibrate your glucometer regularly as instructed by the manufacturer. Answer. Wash your hands with soap and warm water before testing. Prick the side of your finger, not the center. Record your results in a logbook. Calibrate your glucometer regularly as instructed by the manufacturer. This question focuses on essential client education for self-monitoring blood glucose, SMBG, a critical skill for managing diabetes. To ensure accurate readings and prevent infection, clients should wash their hands with soap and warm water, prick the side of the finger, which has fewer nerve endings, for less pain, record their results, and calibrate the glucometer regularly. Using the same finger repeatedly can cause calluses, and sharing Lancet devices is a serious infection control breach and should never be done. For instance, teaching a client to rub their hands together briefly before pricking helps increase blood flow, making the process easier. Proper SMBG technique helps clients effectively manage their diabetes and prevents complications. Question 33. A nurse is caring for a client with a nasogastric (NG) tube connected to low intermittent suction. Which assessments are most important for the nurse to perform? Select all that apply. A. Auscultate bowel sounds. B. Monitor for signs of abdominal distension. C. Check for signs of fluid volume deficit. D. Assess the color and amount of NG drainage. E. Monitor serum calcium levels. F. Assess the client's gag reflex. Answer. Auscultate bowel sounds, monitor for signs of abdominal distension, check for signs of fluid volume deficit, assess the color and amount of NG drainage. This question addresses key nursing assessments for a client with a nasogastric tube on suction, focusing on potential complications related to gastric decompression and fluid balance. Important assessments include auscultating bowel sounds to check for return of peristalsis, monitoring for abdominal distension as it could indicate ineffective suction or obstruction, assessing for signs of fluid volume deficit, e.g., dry mucous membranes, decreased urine output, due to fluid and electrolyte loss from suction, and checking the color and amount of NG drainage. While monitoring electrolytes is important, serum calcium levels are not a primary immediate concern related to NG tube suction. Assessing the gag reflex is relevant for tube placement, but less so for ongoing management of suction. For example, if the nurse notes a sudden decrease in NG drainage without improvement in abdominal distension, it might indicate a clogged tube. Consistent monitoring helps identify and prevent complications. Question 34. The nurse is caring for a client who is receiving continuous passive motion (CPM) therapy after knee surgery. Which actions are appropriate for the nurse to implement? Select all that apply. A. Ensure the client's knee is positioned correctly in the machine. B. Place blankets or pillows under the client's heel to prevent pressure. C. Increase the range of motion settings if the client reports pain. D. Monitor the client's pain level frequently. E. Ensure the CPM machine is unplugged when not in use. F. Turn the machine off during meal times. Answer. Ensure the client's knee is positioned correctly in the machine, monitor the client's pain level frequently, turn the machine off during meal times. This question assesses proper nursing management for clients undergoing continuous passive motion (CPM) therapy, which is used to improve joint mobility after surgery. The nurse must ensure the client's limb is correctly positioned in the machine to prevent injury, monitor pain levels frequently to adjust settings and administer analgesia as needed, and turn the machine off during meals or when the client is out of bed for safety and comfort. Increasing the range of motion should only be done with a physician's order and not based solely on client pain. While preventing pressure is important, specific padding instructions usually come with the machine, and leaving the machine unplugged when not in use is not a standard instruction. It should be appropriately powered down. For example, if a client reports a pain level of 7/10 during CPM, the nurse would pause the machine, reassess the pain, and administer pain medication before restarting or adjusting settings. Careful monitoring and appropriate use ensure therapeutic benefits and client safety. Question 35. The nurse is providing discharge teaching to a client diagnosed with newly prescribed nitroglycerin for angina. Which instructions are essential? Select all that apply. A. Store the medication in a cool, dark place in its original container. B. Take up to 3 doses, 5 minutes apart, for chest pain. C. If pain persists after the first dose, go to the emergency room immediately. D. You may experience a headache or flushing after taking the medication. E. Keep the tablets in a weekly pill organizer for easy access. F. Call 911 if chest pain is not relieved after the 3rd dose. Answer. Store the medication in a cool, dark place in its original container. Take up to 3 doses, 5 minutes apart. For chest pain, you may experience a headache or flushing after taking the medication. This question focuses on critical client education for sublingual nitroglycerin, a medication used to relieve angina, chest pain. Clients must be taught to store nitroglycerin in its original dark container in a cool, dark place to maintain potency. They can take up to 3 doses, 5 minutes apart, for chest pain, but if pain persists after the 1st dose, they should call 911 immediately, not wait for the 3rd dose. Experiencing a headache and flushing are common side effects due to vasodilation. Nitroglycerin should not be kept in a weekly pill organizer, as exposure to light and air reduces its effectiveness. For instance, if a client experiences chest pain, they should take 1 tablet, wait 5 minutes, and if pain is still present, call emergency services while taking a 2nd dose. Prompt action and correct medication storage are crucial for managing angina effectively. Question 36. A nurse is assessing a client for potential elder abuse. Which findings should raise the nurse's suspicion? Select all that apply. A. The client frequently expresses feelings of sadness. B. Unexplained bruises or injuries in various stages of healing. C. A caregiver who is overly protective and restricts access to the client. D. Sudden changes in financial status or missing valuables. E. The client refuses to take prescribed medications. F. Poor hygiene and malnutrition. Answer. Unexplained bruises or injuries in various stages of healing, a caregiver who is overly protective and restricts access to the client, sudden changes in financial status or missing valuables, poor hygiene and malnutrition. This question addresses the important topic of recognizing potential elder abuse, which encompasses physical, emotional, financial, and neglect forms. Unexplained injuries, a caregiver who restricts access or is overly protective, sudden changes in financial status, and signs of neglect such as poor hygiene or malnutrition are all significant red flags that warrant further investigation. While frequent sadness could be a sign of depression, it is not as direct an indicator of abuse as the other options. Refusal of medications might be related to other issues but does not directly suggest abuse without other signs. For example, If a nurse observes that an elderly client has multiple bruises of different ages and the caregiver consistently interrupts when the nurse tries to speak to the client alone, these findings raise strong suspicion of abuse. Nurses are mandatory reporters of suspected elder abuse. Question 37. The nurse is caring for a client with a peripherally inserted central catheter, PIC. Which actions are appropriate for PICC line management? Select all that apply. A. Obtain blood pressure readings on the arm with the PICC line. B. Perform dressing changes using sterile technique. C. Flush the line with normal saline before and after medication administration. D. Clamp the PICC line when not in use. E. Assess the insertion site for redness, swelling, or drainage. F. Use scissors to remove the old dressing. Answer. Perform dressing changes using sterile technique. Flush the line with normal saline before and after medication administration. Clamp the PICC line when not in use. Assess the insertion site for redness, swelling, or drainage. This question focuses on essential nursing interventions for managing a peripherally inserted central catheter, PIC, a central venous access device. Proper PICC line care is critical to prevent infection and maintain patency. Nurses must perform dressing changes using strict sterile technique. Flush the line with normal saline before and after medication administration to prevent occlusions. Clamp the line when not in use to prevent blood reflux and air embolism, and regularly assess the insertion site for signs of infection or complications. Blood pressure readings should not be taken on the arm with the PICC line to avoid damaging the catheter or causing vein compression. Scissors should never be used near a PICC line to remove dressings, as they can inadvertently cut the catheter. For example, when changing the dressing, the nurse would wear a mask, sterile gloves, and perform a thorough antiseptic skin preparation. Adhering to these guidelines ensures safe and effective PICC line management. Question 38. The nurse is assisting a client with ambulation after a stroke. Which actions demonstrate safe assistance? Select all that apply. A. Encourage the client to use the stronger side to push off the bed. B. Stand on the client's unaffected side while ambulating. C. Use a gait belt around the client's waist. D. Walk slightly behind and to the side of the client. E. Allow the client to hold onto furniture for support. F. Instruct the client to look at their feet while walking. Answer. Encourage the client to use the stronger side to push off the bed, use a gait belt around the client's waist, walk slightly behind and to the side of the client. This question focuses on safe ambulation techniques for a client recovering from a stroke, who may have unilateral weakness. The nurse should encourage the client to use their stronger side to initiate movement, apply a gait belt for secure support during ambulation, and walk slightly behind and to the side of the client, usually on the affected side, ready to support if they lose balance. Standing on the unaffected side means the nurse is not in a position to best support the weakened side. Allowing the client to hold onto furniture can lead to falls if the furniture is unstable, and instructing them to look at their feet can disrupt balance and posture. They should look forward. For example, the nurse would apply the gait belt snugly around the client's waist, help them stand, and then walk with them, holding the gait belt. Prioritizing safety through proper technique prevents falls and promotes client confidence during rehabilitation. Question 39. A client is receiving a continuous epidural infusion for pain management. Which nursing assessments are crucial? Select all that apply. A. Monitor respiratory rate and depth. B. Assess pain level frequently. C. Check capillary refill in the lower extremities. D. monitor for urinary retention. E. Assess motor and sensory function in the lower extremities. F. Encourage active range of motion of the hips and knees. Answer. Monitor respiratory rate and depth, assess pain level frequently, monitor for urinary retention, assess motor and sensory function in the lower extremities. This question addresses critical nursing assessments for clients receiving continuous epidural infusions, which carry risks of respiratory depression, motor/sensory changes, and urinary retention. The nurse must frequently monitor respiratory rate and depth for signs of opioid-induced depression, assess pain levels to ensure effective analgesia and titrate medication as needed, monitor for urinary retention because epidural opioids can suppress bladder function, and regularly assess motor and sensory function in the lower extremities to detect nerve compression or excessive block. Checking capillary refill is not a primary concern related to epidural infusions. While encouraging movement is important, active range of motion may be limited or contraindicated depending on the surgical site and the degree of motor block from the epidural. For example, if a client's respiratory rate drops to 8 breaths per minute, the nurse must immediately stop the infusion, administer naloxone if ordered, and notify the provider. Constant vigilance helps ensure client safety and comfort during epidural therapy. Question 40. The nurse is preparing to administer an intramuscular, IM, injection. Which sites are appropriate for administering an IM injection in an adult? Select all that apply. A. Deltoid muscle. B. Ventrogluteal muscle. C. Dorsogluteal muscle. D. Vastus lateralis muscle. E. Antecubital fossa. F. Rectus femoris muscle. Answer. Deltoid muscle, ventrogluteal muscle, vastus lateralis muscle. This question tests the nurse's knowledge of appropriate sites for intramuscular, IM, injections in adults. The deltoid, ventrogluteal, and vastus lateralis muscles are preferred and safe sites for IM injections in adults. The dorsogluteal site is generally avoided due to the risk of sciatic nerve injury, though it was historically used. The antecubital fossa is used for fore-access or blood draws, not IM injections. The rectus femoris is not a commonly recommended site for IM injections due to increased pain and risk of injury to blood vessels and nerves compared to the vastus lateralis. For example, when administering a vaccine, the nurse would typically choose the deltoid muscle if the volume is appropriate. Selecting the correct site ensures safe and effective medication delivery and minimizes complications. Question 41. A client is experiencing manifestations of autonomic dysreflexia. Which nursing actions are appropriate? Select all that apply. A. Place the client in a supine position. B. Loosen tight clothing or constrictive devices. C. Check for a distended bladder or bowel impaction. D. Administer prescribed antihypertensive medication. E. Raise the head of the bed to 90 degrees. F. Provide pain medication as the first intervention. Answer. Loosen tight clothing or constrictive devices, check for a distended bladder or bowel impaction, administer prescribed antihypertensive medication, raise the head of the bed to 90 degrees. This question addresses nursing interventions for autonomic dysreflexia, a life-threatening emergency in clients with spinal cord injury above T6. The immediate priority is to elevate the head of the bed to 90 degrees to lower blood pressure, then loosen any restrictive clothing. Next, the nurse must identify and alleviate the noxious stimulus, such as a full bladder, check for kinks in the catheter, catheterize if needed, or bowel impaction, which are the most common causes. Antihypertensive medication may be administered if blood pressure remains dangerously high after removing the stimulus. Providing pain medication as the first intervention is not correct, as the cause must be addressed. Placing the client supine would worsen the hypertension. For example, if the nurse finds the client's Foley catheter tubing is kinked, releasing the kink and allowing urine to drain often resolves the crisis. Swift action is crucial to prevent stroke or other severe complications. Question 42. The nurse is assessing a client with diverticulitis. Which findings would the nurse anticipate? Select all that apply. A. Left lower quadrant pain. B. Right upper quadrant pain. C. Fever. D. Constipation or diarrhea. E. Rebound tenderness. F. Weight gain. Answer. Left lower quadrant pain, fever, constipation or diarrhea, rebound tenderness. This question focuses on the clinical manifestations of diverticulitis, an inflammation or infection of diverticula in the colon. Clients with diverticulitis typically experience left lower quadrant pain, which is the most common symptom, along with fever, changes in bowel habits, either constipation or diarrhea, and rebound tenderness, which suggests peritoneal irritation. Right upper quadrant pain is associated with conditions like cholecystitis, not diverticulitis. Weight gain is not a typical symptom of acute diverticulitis, although chronic inflammation might lead to weight loss over time. For example, if a client presents with severe localized pain in their lower left abdomen and a low-grade fever, the nurse would suspect diverticulitis. Recognizing these signs helps in early diagnosis and management of the condition. Question 43. A nurse is providing education to a client prescribed lithium carbonate. Which instructions should the nurse include? Select all that apply. A. Take the medication with food to prevent stomach upset. B. Limit your intake of fluids while taking this medication. C. Maintain a consistent sodium intake. D. Report any symptoms of nausea, vomiting, or diarrhea. E. Expect to have your blood levels checked regularly. F. Increase caffeine consumption to enhance the medication's effects. Answer. Take the medication with food to prevent stomach upset, maintain a consistent sodium intake, report any symptoms of nausea, vomiting, or diarrhea, expect to have your blood levels checked regularly. This question addresses critical client education for lithium carbonate, a mood stabilizer with a narrow therapeutic range. Clients should take lithium with food to minimize GI upset, maintain a consistent sodium intake because fluctuations can affect lithium levels, low sodium can lead to lithium toxicity, and report any signs of toxicity such as nausea, vomiting, or diarrhea. Regular blood lithium levels must be monitored to ensure the medication remains within a safe and therapeutic range. Limiting fluid intake or increasing caffeine can lead to dehydration and electrolyte imbalance, which can increase lithium levels and toxicity risk. For example, if a client experiences persistent nausea, the nurse would instruct them to contact their provider immediately, as this could be an early sign of toxicity. Adherence to these guidelines is vital for safe and effective lithium therapy. Question 44. The nurse is caring for a client who underwent a total hip arthroplasty. Which interventions are appropriate to prevent hip dislocation? Select all that apply. A. Place a pillow between the client's legs when turning. B. Encourage internal rotation of the affected leg. C. Elevate the head of the bed to 90 degrees for meals. D. Instruct the client to avoid crossing their legs. E. Encourage the client to bend at the waist to pick up items. F. Use a raised toilet seat. Answer. Place a pillow between the client's legs when turning. Instruct the client to avoid crossing their legs. Use a raised toilet seat. This question focuses on essential nursing interventions to prevent hip dislocation following a total hip arthroplasty, a common and critical postoperative complication. To prevent dislocation, the nurse must maintain hip precautions, which include placing an abduction pillow or wedge between the client's legs to prevent adduction when turning, instructing the client to avoid crossing their legs, and using a raised toilet seat to prevent excessive hip flexion. Internal rotation of the affected leg and bending at the waist beyond 90 degrees are movements that increase the risk of dislocation and should be avoided. Elevating the head of the bed to 90 degrees also increases hip flexion and should be avoided. For example, when helping a client out of bed, the nurse would ensure their hip does not flex beyond 90 degrees and that an abduction pillow is used if they are repositioned in bed. Adhering to these precautions protects the surgical repair and promotes healing. Question 45. A client in the emergency department reports crushing chest pain radiating to the left arm. Which nursing actions are priority? Select all that apply. A. Obtain a 12-lead electrocardiogram, ECG. B. Administer aspirin as prescribed. C. Prepare for immediate cardiac catheterization. D. Obtain blood for cardiac biomarkers. E. Administer supplemental oxygen. F. Assess past medical history. Answer. Obtain a 12-lead electrocardiogram, ECG, administer aspirin as prescribed, obtain blood for cardiac biomarkers, administer supplemental oxygen. This question tests the nurse's ability to prioritize interventions for a client presenting with acute chest pain, a potential myocardial infarction, heart attack. The immediate priorities are to administer supplemental oxygen, obtain a 12-lead ECG, within 10 minutes of arrival, to identify ST segment elevation myocardial infarction, STEMI, administer aspirin to prevent further platelet aggregation, and obtain blood for cardiac biomarkers, troponin, CKMB, to confirm myocardial damage. While preparing for cardiac catheterization is important if a STEMI is confirmed, it is not the first immediate action for the nurse, nor is taking a detailed history. For example, after applying oxygen, the nurse would immediately connect the client to the ECG machine. These rapid interventions aim to preserve myocardial tissue and improve client outcomes. Question 46. The nurse is providing discharge teaching for a client taking spironolactone. Which statements indicate that the client understands the medication? Select all that apply. A. I should avoid foods high in potassium. B. I will take this medication with food. C. I should report any muscle weakness or irregular heartbeat. D. I will drink plenty of fluids to prevent dehydration. E. I should expect to urinate more frequently. F. I need to take a potassium supplement with this medication. Answer. I should avoid foods high in potassium. I will take this medication with food. I should report any muscle weakness or irregular heartbeat. I should expect to urinate more frequently. This question assesses a client's understanding of spironolactone, a potassium-sparing diuretic. Clients taking spironolactone should avoid foods high in potassium and refrain from taking potassium supplements to prevent hyperkalemia. It is best taken with food to prevent gastric upset, and clients should report any muscle weakness or irregular heartbeat, which can be signs of electrolyte imbalances, especially hyperkalemia. As a diuretic, it will cause increased urination. While drinking fluids is generally good, the focus here is specifically on potassium balance due to the nature of spironolactone. For example, Teaching a client to choose an apple over a banana for a snack helps them manage their potassium intake. Understanding these specific instructions helps prevent adverse drug reactions and promotes therapeutic effects. Question 47. A nurse is preparing to administer packed red blood cells. Which actions are appropriate prior to starting the transfusion? Select all that apply. A. Verify the client's identity and blood product with another licensed nurse. B. Warm the blood product in a microwave before infusion. C. Assess the client's vital signs and complete a physical assessment. D. Prime the foretubing with normal saline. E. Administer diphenhydramine prophylactically. F. Obtain written consent from the client. Answer. Verify the client's identity and blood product with another licensed nurse, assess the client's vital signs and complete a physical assessment, prime the foretubing with normal saline, obtain written consent from the client. This question focuses on essential safety actions before initiating a packed red blood cell transfusion, a high-risk procedure. Prior to transfusion, the nurse must verify the client's identity and the blood product with another licensed nurse, a critical step to prevent fatal transfusion reactions. It is also essential to obtain written consent, assess the client's baseline vital signs and perform a physical assessment, and prime the foretubing with normal saline, the only solution compatible with blood E, to ensure proper flow and prevent hemolysis. Blood products should never be warmed in a microwave. Specialized blood warmers are used if warming is necessary. Prophylactic administration of diphenhydramine is not routine and should only be done if specifically ordered by the provider. For example, before hanging the blood, both nurses would carefully check the client's name, medical record number, and the blood unit number against the blood bank tag. Strict adherence to these protocols is paramount for client safety during blood transfusions. Question 48. The nurse is caring for a client with a full-thickness burn. Which interventions are appropriate for managing this wound? Select all that apply. A. Apply ice directly to the burn wound. B. Administer opioid analgesics as prescribed. C. Maintain a warm room temperature. D. Monitor for signs of infection. E. Elevate burned extremities. F. Encourage a high-protein diet. Answer. Administer opioid analgesics as prescribed, maintain a warm room temperature, monitor for signs of infection, elevate burned extremities, encourage a high-protein diet. This question addresses critical nursing interventions for managing full-thickness burns, which involve significant tissue damage and systemic effects. Key interventions include administering opioid analgesics for severe pain, maintaining a warm room temperature to prevent hypothermia due to skin barrier loss, diligently monitoring for signs of infection, elevating burned extremities to reduce edema, and encouraging a high-protein diet to support wound healing. Applying ice directly to a severe burn can cause further tissue damage and hypothermia, and is contraindicated. For example, if a client has full-thickness burns on their arms, the nurse would ensure their arms are elevated on pillows to minimize swelling. Comprehensive burn care focuses on pain management, infection prevention, and supporting the body's healing processes. Question 49. A client is receiving enalapril. Which adverse effects would the nurse instruct the client to report to the provider? Select all that apply. A. Persistent dry cough. B. Mild headache. C. Dizziness upon standing. D. Swelling of the face, lips, or tongue. E. Weight gain of 1 to 2 pounds in a week. F. Increased urine output. Answer. Persistent dry cough, dizziness upon standing, swelling of the face, lips, or tongue. This question focuses on adverse effects of enalapril, an ACE inhibitor commonly prescribed for hypertension and heart failure. Clients should be instructed to report a persistent dry cough, which is a common side effect and may necessitate switching medications. Dizziness upon standing, orthostatic hypotension, is another important adverse effect to report as it increases fall risk. Swelling of the face, lips, or tongue, angioedema, is a rare but life-threatening allergic reaction that requires immediate medical attention. Mild headache is generally common and usually self-resolves. Weight gain of 1 to 2 pounds in a week is usually insignificant unless accompanied by other fluid retention signs. Increased urine output is generally the desired therapeutic effect. For example, if a client reports difficulty breathing due to swelling in their throat after taking enalapril, they should seek emergency care immediately. Educating clients about these specific adverse effects helps ensure their safety and adherence to therapy. Question 50. The nurse is teaching a client about measures to prevent deep vein thrombosis, DVT, after surgery. Which instructions should the nurse include? Select all that apply. A. Remain in bed for the first 48 hours to promote healing. B. Perform leg exercises, such as ankle pumps, every hour. C. Wear sequential compression devices, SCDs, as prescribed. D. Avoid crossing your legs while sitting. E. Stay hydrated by drinking plenty of fluids. F. Get up and walk around several times a day. Answer. Perform leg exercises, such as ankle pumps, every hour, wear sequential compression devices, SCDs, as prescribed, avoid crossing your legs while sitting, stay hydrated by drinking plenty of fluids, get up and walk around several times a day. This question addresses essential preventative measures for deep vein thrombosis, DVT, following surgery, a serious complication. To prevent DVT, clients should perform leg exercises like ankle pumps frequently, wear sequential compression devices, SCDs, or anti-embolism stockings as prescribed, avoid crossing their legs to prevent venous compression, stay well hydrated to prevent blood viscosity, and ambulate early and frequently to promote circulation. Remaining in bed for prolonged periods increases the risk of DVT. For example, teaching a client to do 10 to 15 ankle pumps every hour while awake stimulates venous blood flow in the lower extremities. Emphasizing these interventions helps reduce the risk of clot formation and promotes a safe recovery.